guys, we are so excited that you are here for Lipstick and Lipo. My name is Dr. Ashley Amalfi. I'm a board certified plastic surgeon in Rochester, New York, and I'm joined by my co-host, Dr. Smita Ramanathan, in New Jersey. So we are so excited to bring you Lipstick and Lipo. This is your unfiltered guide to plastic surgery by two board certified plastic surgeons. And today we're excited to continue this recovery talk. So we've gone through so many procedures, what to expect in your recovery. And today we are kind of continuing in that series, and we are talking about breast lifts. Are you excited, Smita?
I am so excited. I feel like all of these recovery topics and episodes are such game changers, right? Because that's what people want to know, that you're not necessarily going to find always online. And then when you're in the consultation, there's a million other things you're talking about. So it's so important. Obviously, we all have busy lives and we have to plan accordingly. We want to know what we're getting ourselves into. So this is another big surgery that we do, very popular surgery. So we're going to sort of break down recovery and what to expect and all of that fun stuff.
All right, so let's get right into
breast
it.
Lift.
Breast lift.
Yes.
Here's the reality, you guys. This is probably the easiest recovery of anything we do, which is wild because you guys think about it for your whole lives. You're like, I want to lift, I want a small reduction. You think about it from the time you're teenagers, and there is no need to not just do it right away, because this is probably, I would venture to say, the very easiest recovery of anything we do. What do you think?
Yeah, I mean, I 100% agree. And you're so right, Ash. I mean, people think about this forever, whether they, just as they developed, have larger, saggier breasts after pregnancies, after weight loss. You spend all this time trying to lose weight and get, have a healthy lifestyle, but then your breasts sort of just go south. But there's really no need to be nervous about it, because recovery is so easy. And I think the other thing that people are scared about is that, the incisions, they're a little bit, either the anchor incision, or the lollipop incision, but that doesn't mean that it's more painful by any means.
I think people see that there's a lot of incisions and they just imagine that that's going to hurt, but I think patients are just floored that it really doesn't. And I think, I think the secret behind that is that we're not working on muscle. And we've talked about it in different episodes. When we're operating on muscle really hurts. It gets really sore. We are not operating on muscle when we do a lift or a small volume change. We are really just operating on skin and breast tissue. And the secret is it doesn't really hurt. It's just a little stingy incisional pain, and that's it.
Yeah, and it goes away really quickly. I mean, it's so fast. So the first 1 or 2 days, you're going to be sore. Obviously you just had surgery, you're going to be sore. We give you medications. We inject medications at the time of surgery that last, hours after the surgery. But then you could turn that corner, by 36, 48 hours, I think most people are off of their pain medication. They might take a pill at night or something just to help them sleep. But they've transitioned to Tylenol or whatever, ibuprofen, whatever it is. But you feel great. And that's when I worry about you, because that's when you start feeling good and you're like, oh, let me do that load of laundry, or let me do whatever it is. And, your body's still recovering. So you still have to take it easy, but you do feel that much better.
Yeah, you're right, Smita. It's almost like too easy to have a breast lift. It's too easy to have a breast lift because everything feels so darn good on the outside that you forget that there's so much healing happening on the inside. And so it's deceiving. This is such a quick recovery that I would say it's deceiving, because you don't want to overdo it. You don't want to run back to the gym for the first, you really want to stay away for the first 3 weeks because you don't want to create bleeding. But the reality is you're not going to be home in bed suffering. You're going to feel pretty good after a breast lift, and you're going to want to get out there and be doing normal stuff. You just have to really modify, take it easy, try to have as sort of boring of a schedule as you can. And that's usually what I tell people. That's like my one-liner when I see patients at 1 week. I'm like, I want the next 2 weeks to be really boring. So just, if you think in your head like, oh, should I do this? Should I not do this? Just know that Dr. Amalfi would say, no, you cannot.
No.
Even though you feel good and you want to, the answer is going to be no. So that's the hardest thing about this, right?
Yeah, exactly. I mean, really, you feel so good that you want to jump back into those things. And I think after the first 2 days, right, you do turn that corner, so you feel good. You're not
Yes.
quite ready to get back to exercising, but you do feel good, just doing your normal day-to-day stuff, and you still have to take it a little bit easy. But then by that 3 or 4 week mark, you almost forget you've had surgery because nothing hurts,
Yes.
nothing. And then that's when you are like, oh, let me go take this class or do whatever. And that's when you have to just
Yep.
take a step back and just realize your body still needs a full 6 weeks, 4 to 6 weeks to really recover and get those incisions to be as strong as that they're going to be. But the good thing
Yeah.
about all of this, which is so awesome about these volume reduction, volume changes, breast lifts, is that you see the results right away, right? I mean, your breasts are just immediately up.
Gorgeous.
The size is what you want. There's swelling and there's all of that stuff, but you see it as soon as you wake up, which is really cool.
It's exciting. It's exciting because it's like instant gratification. They instantly look great. They're a little swollen, but everything is kind of exactly what you were waiting for. And so, I mean, even on day one, I have patients, I'm sure you do too, who come in and on day one, they're like, this was so easy. I have no idea why I waited my whole life to do this.
Yeah. Yeah.
Because it's really that easy on day one.
It really is. It really is. It really is. I mean, I think that initial day, and sometimes people from the anesthesia might have some nausea or whatever it is.
Yeah.
But those things you may feel a little groggy because it does take some time to get that all out of your system. But for the most part, I mean, it's really easy,
Yeah.
And, obviously the first thing they say to us, and I'm sure, you too, is, why didn't we do this sooner? Why did I wait so long? Why was I so nervous? Why was I was so scared about the pain? But you shouldn't be. I mean, the results are so worth it. You feel good. And I usually have, by 1 or 2 weeks, I think people are sort of doing their light exercises, right? Walking, things like that.
Yeah.
The only thing I tell them is, like you said, keep it boring. Wear like your Apple Watch or whatever it is. Make sure your heart rate is under 100 so you don't cause bleeding. But that's really
get back
it.
to it. Yeah. Do you use drains or anything like that? Do you have anything like really aftercare?
I don't use drains for breast surgery, really, unless I'm doing something different where I'm like taking out an implant or something like that and not replacing it.
Yeah, same for me. I don't. And I think people are always worried about that too, because historically, like, breast reductions were these huge surgeries and they were done in the hospital, and you spent days in the hospital. You might need blood transfusions and, drains.
Oh, gosh.
It was crazy, This is, we have come so far when it comes to breast lifts and reductions that none of that is to play anymore. People really don't use drains. There's not really big external stitches to take out. Everything is absorbable under the skin. Like, there's really nothing to take care of. It's in and out outpatient surgery. It's fast, it's safe, it's beautiful. And I mean, the reality is
you can shower
the
the next day.
Yeah, jump in the shower. I'm cool with
right?
that. Yeah,
everything is underneath the skin. You don't have to worry about it. And really, the only thing you need to do is wear a bra that doesn't like rub against your incisions.
Exactly.
Like no underwire, just something full coverage.
Yeah, that's what
sort
we
of
do
really
too.
it, right? A
That's
sports
it.
bra, just whatever it is that's not too compressive, doesn't dig in anywhere, and
just enjoy it. I mean,
you
even like when
on.
you go home, you're gonna like. Even in your clothes, even in this bra we put you in after surgery, everything is going to look so good. You're just going to be so excited to have those perky, cute breasts exactly where you want them, exactly the size that you want them. And it's just like instant gratification with really minimal downtime. And so this is a super easy one.
And what's so like the best part, I think, for me is when. So I usually see people back at 1 to 2 weeks. It sort of just depends on what's going on.
Yeah.
Generally 2 weeks, but I mean, people just look different when they come in, right? You're standing taller because you don't have these breasts that are sort of like pulling you down. You're not hiding your breasts, which I think a lot of patients, whether they're bigger, saggier, whatever it is, people tend to hide it, right? So
they
you're
like
wearing looser
lean
clothes.
forward.
They lean forward. They hunch. They're not doing that. And then all of a sudden you can see like their smaller waistline, like everything, they're wearing
skinnier.
tighter clothes. They look skinnier.
Yeah.
And you can just see, right? All of that is just like their confidence. You have your confidence back, which I think is the most rewarding out of all of this, right?
Yeah,
I think it's why we do what we do.
It's like a guarantee that if you have a breast lift or a reduction and you go down in volume of your breasts, people will, without a doubt, ask you if you lost weight, because you just carry
100%.
yourself differently. You show off the small parts of your body, and you just look so much more petite when that breast is perky and fits your frame right where it's supposed to be. It's just like it's a game changer for your body. Just that whole persona changes, and it's so cool to see.
It is really, really cool to see. But yeah, I mean, easy recovery. If you're thinking about it, don't wait any longer. Go see a board certified plastic surgeon, get your surgery, and just like, you know, enjoy your new breasts.
Yeah, easy as they come, you guys.
You won't look back.
We promise.
Exactly. Well, awesome. This was a great episode on recovery after a breast lift. We've got a few more recovery episodes coming up in this series. So make sure you follow along, subscribe to Lipstick and Lipo on YouTube, and listen to us on Spotify. You can catch us there and listen to us on your way back and forth to work if you're back in the office, which we've both been in the office, so we can.
Yes, we'll see you or hear you.
Yeah, exactly. All right, guys, we'll see you next week.
Bye, Smita.
Bye, Ashley.